joined by Dr. Abhay Soi, who is the CMD at Max Healthcare Institute. A very good afternoon to you, Dr. Soi. Thank you so much for joining us on ET Now. And let's talk about the bed occupancy in the quarter gone by. It stood at around 54%, and only 1% of the total occupied beds were actually used for COVID-19 patients, compared to approximately 7% in the previous quarter, that is Q4 of FY22, and 39% in the quarter last year, that is Q1 FY22. So now that the hospitality required for COVID-19 has actually dipped, how do you expect to see the bed occupancy rate shaping up going ahead?
Yes, so we're expecting marginal improvement as we go along into the next couple of quarters. We were at about 70 to 72% prior to COVID. We are at 74. You see it marginally sequentially go up over the next few quarters. But at the same time, the bigger pivot for us is to distill the payer mix, because once you sort of get to high occupancy levels that we are operating at present, you see a distillation of payer mix where you have beds being consumed by higher payer groups, both in terms of the paying capacity as well as the surgical mix. So that's the important pivot that we are going to look forward to over the next few quarters.
Domestic medical tourism is back. International medical tourism is also back above the pre-COVID level. What is the outlook for the sector then?
No, so we are very, very excited about this space. I've been saying it for a while. This is an area where India has a comparative advantage, and we need to sort of, gather momentum as far as this initiative is concerned. Do keep in mind, it's back to pre-COVID levels. This is in spite of the fact that Afghanistan, which has been a key market for us traditionally, has been shut down. Yet, we've been getting immense amount of medical tourists from other parts of the world, which is made up for this shortfall from Afghanistan. And coupled with the fact that I believe now even the Prime Minister, is going to be announcing, perhaps one reads, Heal in India initiative, on Independence Day, which has got a lot to do with medical tourism to India. So I think, medical tourism is clearly a very, very exciting space for us. And we expect these numbers to ramp up significantly in the years to come.
Dr. Soi, you have categorically stated that you are seeking to employ your deleveraged balance sheet towards inorganic growth opportunities in the near term. Are you already in talks for inorganic expansions, or any medium short-term acquisitions that we could actually brace ourselves for?
So we are always in talks for potential acquisition, and we are at present as well. I think, there's nothing to announce. We would be announcing it to the stock exchanges if there was to. So what we do believe is that in the near term, we will be employing. Is it going to be immediately over the next couple of weeks? Perhaps not. But yes, in the near term, we are, like you said, almost a debt-free balance sheet. We have net debt excluding put options of about 70 odd crores, including put options, it comes to 200 odd crores. So, it is significantly, it's about 1 month's EBITDA for us. So clearly, going forward, we are going to be employing our balance sheet for inorganic growth. Like I said, again, it's not, something in the near term for sure.
Net debt has reduced to about 217 crores versus 441 crores. What's the roadmap? Do you plan to be completely debt-free?
No, so like I said, it's better than the 200 odd crores, because 200 crores includes a put option of about 140 odd crores. So really, it's, I think, about 60 to 70 crores of actual net debt on our balance sheet right now. So yes, I think, you should be effectively net debt free in the next quarter or so.
All right, we leave it there. Thank you so much, Dr. Soi, for joining us on the show to talk about the quarter gone by for Max Healthcare.